Dr. Tan Wu Meng.
I thank the ministers for their statements. I'd like to ask one clarification to highlight a group of individuals who may well benefit from expedited access to the COVID-19 vaccine. These are Singaporeans who serve Singapore overseas, often in jurisdictions where COVID may be very prevalent, and even with the best protective measures, they may come face to face with a COVID-infected person during their overseas duties. These include our public officers at overseas missions, whether from MFA, MTI, or MINDEF. Another related group would be our national sportswomen and sportsmen, some of whom may be training overseas, some of whom may be back home in Singapore right now, like one of my residents, but at the same time worried about what will happen when they return overseas for studies, when they go overseas to train, and may again come face to face with a COVID-infected person while flying Singapore's flag. So I would like to ask the ministers, what is the policy approach that will be taken to support Singapore public service officers and our Singaporean sportswomen and sportsmen who represent us overseas, often in jurisdictions where COVID is running rampant? Thank you very much.
Thank you. I'd like to thank Dr. Tan for his questions and clarification. In fact, these are issues that the multi-ministry task force is discussing, and we are also consulting the expert committee on the vaccination on how to deal with various priorities. As I mentioned earlier, the key priority today is to focus on the healthcare workers because they are at the front line and they are dealing with the patients, and some of them could be, in fact, infected with COVID-19. So our priority is to first protect the healthcare workers, ensure they can continue to preserve our healthcare system. Secondly, we look at those who are at high risk of a severe outcome should they be infected. This includes vulnerable seniors, and therefore this is a second group that we will be focusing at. And beyond this, we are also looking at different categories of people, including key entities like our military, our police force, and which are very important in ensuring law and order and national security, as well as our foreign representatives, our embassies overseas, which are particularly in countries where there's a high prevalence of COVID-19. They are doing our protecting Singapore's interests, and we should find ways to protect them as well. So all these are factors that will be taken into consideration. But as you point out, there are many groups, and many of them also are facing challenges, and we do want to protect them as much as possible. So the key really is to expand our vaccination as quickly as possible to cover as many people as possible. And if your turn is now your turn, please come forward and get vaccinated. Don't wait. And this is the only way for us to protect individuals as well as to protect one another. But I take your point that there will be different groups that have interests and that requires protection, and we see how we can manage our vaccination program to meet their needs. But bearing in mind that the priority is still to protect our healthcare system, our healthcare workers, and the next priority is really the seniors, which are vulnerable to severe outcomes.
Dr. Lim Wee Kiat.
Thank you, Mr. Speaker. Let me thank both ministers for the statement. The pandemic itself is a war. Currently now, when we first saw the first shipment of the vaccine that arrived in Singapore with Minister Wong receiving it at the airport, we were very happy. But subsequently, we were a little bit disappointed with the speed of the rollout of the vaccine. In fact, in Canada, during Christmas period, they closed the vaccination center and it was being slammed. For why did you close the vaccination centers during Christmas? They should be speeding on now to quickly vaccinate as many people as possible. As from today, Israel has already vaccinated 12% of their population. I'm just wondering whether, initially I was hoping that Singapore should be the first country in the world to get the whole country vaccinated. If any country can do it, Singapore can do it. We can show the world. Because we are small, we are fast, we are efficient, we are organized. If this is a war, I would say that vaccination, initially I was hoping for it to make it mandatory. Of course, the government has chosen to make it voluntary. I know that vaccination is a personal choice, but it has public consequences. I certainly urge everyone to be vaccinated as soon as possible. So I hope that the ministers now can consider to roll out this vaccination program faster than what we are talking now. Because as it is now, I'm not sure that why are we waiting for? We should be vaccinating more people now. In fact, I hope that the healthcare workers should be vaccinated within the next 2 weeks, and it should be completed as soon as possible. And next, I would like to ask also, when will the Speaker, Deputy Speakers, and MPs be vaccinated? Thank you.
First, let me thank Dr. Lim Wee Kiak for his enthusiasm and his strong support for our vaccination program. In fact, I do agree with him. Our objective is to roll out our vaccination program as quickly as possible, but having to bear in mind that we still have limited supplies, and we need to progress based on the supplies that we can receive. And secondly, I must also stress that we did not rest over the Christmas or the New Year. The key reason for our approach is to adopt a cautious one, because vaccination is a very complex process, particularly bearing in mind that we need to ensure the ultra-cold chain is intact to assure the quality and efficacy of the vaccine will not be affected. So that's one. Secondly, we also want to make sure of the safety of those who are receiving the vaccination, making sure that there are proper queuing system, they are registered properly, and the data are captured accurately. So it is quite a complex situation. So we conducted a trial recently, last week, and we'll be rolling out a full-scale vaccination for the healthcare workers, and hopefully soon we will be able to make it available to Speaker as well as members of the Parliament. And I think it is important that we also roll out for the rest of Singaporeans. So I agree with Dr. Lim that I'm equally anxious to reach out to cover as many Singaporeans as possible, and I look forward to members to help support our effort and to convince your constituents to step forward when their turn comes for the vaccination.
Ms. Sylvia Lim.
Thank you, Mr. Speaker. I have two clarifications for Minister for Health. The first is whether the Health Sciences Authority works with any threshold for efficacy before it approves any vaccine. So I read, for example, that in the US, the regulators need a minimum efficacy threshold of about 50%. Does the HSA have some minimum threshold that it works with before considering approving any vaccine? So that's the first question. The second clarification concerns HSA's approval of the Pfizer vaccine. HSA has announced that it is actually an interim authorization and that further data, probably longer-term data, will need to be submitted by the manufacturer before the vaccine can be given full registration. So I'd like Minister for Health to, for public consumption, to explain what additional information the manufacturer needs to submit in order to get full registration for the Pfizer vaccine. Thank you.
Thank you. First, on the question of efficacy threshold, it is true that WHO and generally US has a threshold of 50%, and we too have a threshold minimum of 50%. But I think the efficacy threshold will have to be taken into account, has to take into account the potential risk that it may create, potential risks of adverse incidents, as well as other factors. So it is not a clear-cut threshold that once it is 50.1%, we will approve it. If there's greater uncertainty, then we will require a higher level of efficacy for us to be assured of the benefits versus the risk. It also has to take into account the current situation of the pandemic. If it is a very severe pandemic, then it is important for us to ensure that we vaccinate our population as quickly as possible, and therefore we may then have to accept a lower threshold of efficacy. If the pandemic is less severe, low mortality and so on, and therefore we may require a higher level of efficacy. So basically it's a balance of benefit and risk. So it is a holistic assessment that the HSA's experts will have to take into account in coming to a conclusion whether or not it will be approved for use. So it's not just a single number. Secondly, you asked, Ms. Lim asked about the meaning of interim approval and what long-term data we are looking at. Basically, because this vaccine has been made available only in recent months and it has been applied only for a couple of months, and we still need to monitor how it is applied in real life, and manufacturers are required to report any adverse incidents that happen so that we can keep track of the performance of the vaccine on the ground as well as the potential risk that it may carry. And we need to do this continuously for a prolonged period of time, usually 1 year, 2 years, or maybe longer, so as to give us assurance of the long-term effect of this vaccine. So therefore, this is part of the reason why HSA will have not given a full authorization, because a full authorization will require this long-term data to be available before we do so. But in view of the pandemic that we are facing today, HSA has given interim approval for the use of this vaccine, accepting the fact that long-term data will only be available in the long term, and we will need to continue to monitor and to make our assessment in the long term.
Ms. Fumiha.
Thank you, Speaker, and thank you to the ministers for the comprehensive responses. I have two supplementary questions. First, we take comfort from Minister Gun's report that Singapore has secured sufficient supplies for the entire Singapore local population, and that vaccination is anticipated to complete by third quarter 2021. I would like to ask the minister, what are the risks of Singapore not getting the delivery of our vaccine orders? So even though we have secured, whether they will be delivered, as we compete with other nations to get hold of the vaccines? That's the first supplementary question. The second supplementary question, testing has been a key requirement for travel under COVID conditions. I would like to ask the minister whether the government will add vaccination in the future as a qualification for travel and perhaps even for employment in certain occupations or engagement in certain social activities. And particularly also, or related to this question on vaccination, how would vaccination be featured in the upcoming World Economic Forum to be hosted in Singapore in May? Thank you.
Thank you. On the delivery of our advance order for vaccines, there is always a risk of non-delivery or the delay in delivery. So we are in close contact with our manufacturers that we have entered in contract with, and we are monitoring their delivery schedule. And part of our vaccination program have to adjust ourselves. And we are also looking forward to more vaccines being approved, so we have alternatives. We want to make sure that we diversify our sources of vaccines so that even if one shipment is delayed, we have access to other supplies. So this way we ensure that we have adequate vaccine supplies for the whole of Singapore. With regard to the travel questions, I'll leave it to my co-chair to respond.
Mr. Speaker, it's important that we look at vaccinations as just part of the broader suite of measures that we have to protect ourselves, including safe management, testing, and contact tracing. Vaccination is not a silver bullet, right? It's just part of that overall system. As I mentioned just now, we are still assessing the extent to which vaccinations can help reduce transmission risk. We know when you get vaccinated, you're protecting yourself. We don't know how much you can protect others. Yes, there will be some beneficial impact, but what is the extent? It's still under consideration. So until we understand the effects of the vaccine, I think we will not be able to make any changes to our measures, be it domestic or travel measures. But if the results indicate that vaccinations do offer protection to others, and then clearly we can make some adjustments. What are some of the adjustments that are possible? For example, if there is a concert being held today, typically under today's rules, we would require a pre-event test for everyone going into the concert. Potentially, if you have been vaccinated, we might say, well, someone who has been vaccinated need not take such a pre-event test. That's conceivable. Subsequently, if we have, again, more evidence, we might say for travelers, well, you do not need a vaccination to travel, but if you are vaccinated, you travel and you come back, I might consider the extent to which I impose the SHN conditions or the number of tests you are required to take. These are also possible. So those are the things that we are looking at, and these are all being studied very carefully. For purposes of the WEF events, which Ms. Fu highlighted, well, if the travelers come in on a vaccine, and if we have the data and evidence, then indeed we can review the requirements that we impose on these travelers. But otherwise, the basic arrangements for the WEF event will be through existing prevailing measures. For example, we would bubble wrap a facility, we will put the travelers under frequent testing to ensure that they are safe, we will have safe management measures in place. All of these measures are still effective and we should still continue to rely on them.
Mr. Louis Chua.
Mr. Speaker, I got two follow-up supplementary questions for the Minister. So firstly, I understand that because of the commercial sensitivities, the exact number of doses of vaccines cannot be shared, but perhaps the Minister can share with us in aggregate the number of doses that has been secured to give people the assurance that that is more than sufficient. And as alluded by I think Dr. Lim as well as Ms. Fu, I think you will also give Singaporeans comfort to know of the expected delivery timeline of when they will be able to look to be vaccinated in the next, the rest of the year. I think the second question is also a follow-up question to what Minister has said in terms of the individual autonomy to choose the vaccines. And so for people who are within the same category, for example, who are Singaporeans, who are male of a certain age, what is the approach or process by which the vaccine is being administered, given that should there be more than one that's being approved, and would the ministry actually provide the up-to-date information as to the different side effects, efficacy rates, as well as various clinical trial data for people who are being administered a particular vaccine to have a sense of what these are? Thank you.
Thank you. I thought I've answered the question on the quantity. I won't be able to give the specific number, but suffice to say that we have secured sufficient for the whole of population. And our strategy is also to ensure that we have a portfolio of vaccines and not just rely on a single supplier. Of course, today we have approved Pfizer-BioNTech, and we are continuing to evaluate two other vaccines I mentioned in my speech. And with regard to The second question, I'm not quite sure what was the question. It was about how do we administer the vaccine if there are different types. As I mentioned, it will be based on the assessment. If there are significant counter-indications for specific vaccine that maybe, say for example, if a vaccine is not suitable for young children and another vaccine is suitable, then we will use the vaccine that is suitable for the young children. So depending on the indication that is provided by the manufacturer. But if the indications are similar, then it will also depend on the availability of the vaccines at that point in time, whichever stock is available, and so long as we are able to administer them, we would use the vaccine that is available to us. So the key is that whatever the vaccine, sources of the vaccine, all of them must meet our safety and efficacy requirements. So from a safety and efficacy point of view, they should be treated similarly. But at the same time, as I think the member has pointed out, we do provide the information on these vaccines. I think HSA's assessments are published, reports are available, and the manufacturers also share a lot of details with regard to the potential side effects of these vaccines, and I mentioned some of the side effects in my statement earlier.
Mr. Alex Yam.
Thank you, Mr. Speaker. I thank the ministers for their ministerial statements. With regard to my question, the answer provided by Minister earlier is that based on the recent surveys, over 60% of Singaporeans were prepared to be vaccinated. I'd like to ask the Minister two follow-up questions. One, is this figure of 60% satisfactory to the MTF? Should it be higher? Because we had mentioned that we should be looking at above 70% vaccination rate. Second question is, as more vaccines come on stream or are approved for use in Singapore, firstly, the sentiments with regard to different vaccines, will that also be similarly surveyed? Thirdly, when these additional vaccines come on stream, anecdotally over the weekend as I was speaking to residents as well as family members as well, quite a number of older Singaporeans seem to indicate a preference for CoronaVac, which is the vaccine that's developed by Sinovac, which is not using the new technology. For some reason, they indicate that it's because it's older technology is more established. If it comes on stream, they would like to choose to have that. But if in the event that at the time that they are assigned to take their vaccinations and these other variants of vaccines are not available and they reject the current vaccines, how soon, when new vaccines come on stream, will they be eligible to be vaccinated again?
Thank you. Let me say that we hope that more than 60% of Singaporeans, in fact, ideally everybody in Singapore should be vaccinated. And therefore, regardless of whether it's 60%, 70%, we must work hard to try to get the last person to get vaccinated. So the government alone cannot do this. We need everyone to chip in to help, the professionals counseling your patients and their family members to get vaccinated, and members of parliament going down on the ground, persuading the constituents to step forward and get vaccinated. So I think we want to push the coverage to as high as possible a level so that we provide protection for, especially for those who cannot be vaccinated because of medical conditions and for various reasons. And there are some for whom the vaccine may not be effective, because effectiveness is 95% for Pfizer-BioNTech. And therefore, we need to protect them by making sure that all of us are vaccinated to the extent possible. So I urge members to continue to help us to share this message that we want to encourage Singaporeans to step forward to get vaccinated. With regard to Sinovac or any other vaccine that has not been approved, my advice is don't wait for them, because we do not know when they will be available, and we also do not know whether they will be approved at all, because until we have the full information, until we have completed the review, I cannot assure you that these vaccines will be available and in the short term or even in the long term. So let's not depend on something that is far away. Focus on what we have today, and that's a Pfizer-BioNTech vaccine, and get vaccinated. And when additional vaccines are available, we will share the details with Singaporeans, including the safety, efficacy data, and everything. So we aim to be as transparent as possible. Even side effects, adverse events, we share with everyone so that we can all collectively make informed decision. So I think it is important to be transparent so that we can maintain the trust between the government and the people, and so that we can embark on this vaccination program together as a country.
Mr. Dennis Tan.
Thank you, Mr. Speaker, sir, and I thank the two ministers for your ministerial statements. Just now, Minister Lawrence made some comments in respect of the parliamentary question I filed for tomorrow's sitting, and essentially I've asked whether the government is considering or working on a rechargeable version of the Trace Together token, and whether battery replacement for the current version will be provided without charges. So I'd just like to seek some clarification from the Minister following his comments. That is, does it mean that the government will provide free replacement of the current token, free replacement with similar models, not a rechargeable version, when the battery runs out, say after 6 months, which I've read on the literature that the battery will last about 6 months. And a second clarification is, has the government already computed that this current non-rechargeable version, if supplied free of charge to all Singaporeans, will cost the government less in the longer term as compared to a rechargeable version? And this is not forgetting the environmental costs arising from the current model. Thank you.
Mr. Speaker, we had indeed considered these sort of factors on whether or not to have a battery or a rechargeable version. I think if you consider the imperatives of what we had to do, roll out the tokens very quickly and get it distributed in a short time, there is no question. This is, we have to use a version that allowed us to use off-the-shelf components. We don't have to incur more cost. We don't have to incur greater complexity in manufacturing. So that was very clear. In terms of battery replacement, yes, for the tokens that we have today, the batteries will need to be replaced, and we will put in place implementation process to facilitate that for free for everyone. Some of it can be done through a simple replacement, depending on the version of the tokens, because there are different versions. Some of that can be done just through a simple replacement of the battery. You need not do a one-for-one swap. In other instances, it may be easier to do a one-for-one swap. But we have indeed taken into consideration all of these factors, including the fact that with the current model, you may need to do a one-for-one swap, but we overall still think that this approach, given the circumstances, given the urgency of rolling out the tokens, was a better approach.
Mr. Lim Bao Chuan.
So many of my residents have expressed concern about the speed of the development of the vaccine, and actually a minister's assurance was very helpful in allaying their fears. But sir, I want to ask the Minister for Health. I recall that in the 1950s and 60s, there was this wonder drug, thalidomide, which had severe side effects for pregnant women. So let me ask the Minister, what assurances are there that there would not be adverse side effects which may show up perhaps a few years later, especially for pregnant women? Another clarification which I want to ask the Minister for Minister Lawrence Wong is about the Trace Together token. So I hear what Minister has said about residents collecting tokens even though they have apps in their smartphones. I feel a bit disconcerted because I feel that for residents to collect them and keep them as reserve is really quite a waste of resources. And the literature, as the Honourable Mr. Dennis Tan had said, the battery runs out in 6 months, and they'll be given the free replacement of the battery. If it's damaged, there'll be free replacement with token. If you lose it, there'll be a first free replacement as well. So I feel that we should encourage our residents not to waste resources like this. Use the app if they have it in a smartphone. And for those who don't have the smartphone, then yes, we want to encourage them to adopt this Trace Together app by collecting the token. But certainly for those who have smartphone, I hope that the Minister can reconsider and ask those who have smartphone to not collect or not seek a replacement when the battery wears out. Thank you.
Sir, let me address the first question on the long-term side effects for pregnant women. Maybe Minister Lawrence Wong can deal with the Trace Together token. In my speech, I explained that specifically for pregnant women, because the data is insufficient for the time being, and therefore we have advised pregnant women not to be vaccinated for the time being. And we are continuing to do research to study the effects on the pregnant women. The manufacturers are doing that, and as data emerges, we'll look at the data and reassure ourselves whether it is safe for pregnant women to take the vaccination. So that is a safety precaution we are putting in place. And they are also looking at indications even from a short-term reaction to see whether they are likely to have long-term effects on pregnancy. So I think these are the part of the scientific work that's ongoing. Rest assured that the committee, HSA, as well as expert committee, will take into account all these data before recommending vaccination for the pregnant women.
Mr. Lawrence Wong.
I just want to say I fully agree with Mr. Lim Biao Chuan. Thank you for making the plug for the app. For those who have smartphones, there's really no need to collect the token. I have not collected my token. I don't see a need to collect my token either, because I'm quite happy using my app. So we will continue to strongly encourage everyone with the app. Use the app. We will try to make the app more useful, add more features, and hopefully when we do that, it would further tilt the balance and encourage more people in favor of using the app as opposed to the tokens. But to the extent that Singaporeans want to collect the tokens, I think we do want to make them available, reduce any anxieties associated with the rollout of safe Trace Together only safe entry, and that's why we are doing this one-time distribution. We will complete that soon, and then we will transit, as I say, to this new phase of having TT only safe entry. But I share Mr. Lim's concerns, and I would strongly encourage all of us to put the message out to our residents. The app is just as effective, perhaps even more effective when new features are added on, so please use the app.
Mr. Leong Man Wai.
Mr. Speaker, I thank the ministers for giving us so much information today. To the Minister of Education, I'd like to clarify that I'm not trivializing the effort of the government that the government has put in from bringing us from phase 2 to phase 3. However, I'm also reflecting some sentiments of many Singaporeans that since there's not much change from phase 2 to phase 3, we would like to know a longer roadmap whereby we'll get closer to the pre-COVID situation. Although it's a new normal, we like to see this new normal to be far more liberal than before. Okay, so we would like to know, would like the minister to enlighten us on that. Some areas that perhaps we like to ask is that one is if we attain a certain level of vaccination, are we going to open up? Two, if we attain a certain level of testing capability, especially in the rapid test capability, are we going to open up? Three, are we doing our, can we upgrade further the way we use our tracing technology? Okay, for example, just now we are talking about the token. why the government actually introduced token when we could have pushed everybody into smartphone in the first place. Okay, so there are all these questions that are on the mind of many Singaporeans, and to open up any of these conditions can be satisfied, or a combination of these conditions will allow us to be closer to the full opening up. Thank you.
It would be useful not to repeat some of the questions have been answered, please. Thank you.
Mr. Speaker, the changes, Mr. Yong reflected the sentiments he says that people have, that these changes from phase 2 to phase 3 are not very meaningful. But in fact, when you go from 5 to 8, in groups of 5 to groups of 8, you are adding a lot of risk, particularly if one person go out multiple times, each time a group of 8 persons, eating, dining, visiting, you are adding a lot of risk. So I would say, let's don't sweat the small stuff, It may appear small, but these are significant moves that we are making. I think people do appreciate that they can meet in larger groups, meet with their family members, meet with their loved ones. And each of these times, every time we make one step forward, relax a measure, we are adding risk, and all of the risk do add up. So it's not just simply saying, oh, the situation looks very good, let's keep opening up, But each time we make a move, we have to be very sure that we have the tools and the enablers to keep the infection under control. With regard to these different tools on testing, on tracing, we have already reached quite a high level. We have reached the desired capacity of testing that we wanted to build up. We have the capacity to test more frequently, and we are going to do more using rapid tests. We have 78% of people in Singapore on Trace Together. It's already a very high percentage, probably the highest in the world on a Trace Together, on a contact tracing system, and we will still try to get higher. So on these, we are doing quite well. The one thing that can allow us to open up more is vaccinations, but we will only be able to get people vaccinated, a significant number of people vaccinated, as we said, by the third quarter of the year. So between now and the third quarter of the year, let's not rush to make big changes and big relaxations. We have to do this in a controlled manner, recognizing that the risks are there, and the virus is raging everywhere in the world, and there are new strains emerging. So let's do this in a very controlled, careful, calibrated manner. Even after we have had a lot of people in Singapore being vaccinated, it doesn't mean that everything is over, because no country is safe until everyone in the world is safe. And it will take some time for the whole world to get vaccinated. So yes, getting all of us in Singapore vaccinated is important. It will enable us to move further in terms of relaxation of measures for travel, for our own resumption of activities within Singapore. But if your hope is to get back to a pre-COVID sort of normal, I think we still have to be circumspect, and we still have to be realistic. Right? The virus is still going to be raging in many other parts of the world. Vaccinations will take time to distribute to every country, to everyone in the world. So we have to be prepared to live with COVID for quite a while.
Mr. James Lim.
Let me start by thank you, Speaker, and let me start by thanking both ministers for not just the update, but their hard work, and indeed the work of all government ministries and agencies. It has been a long road to get us here, and I, for one, feel very thankful. I have two clarification questions that should be very quick to answer. The first is, given that the endorsement for the usage of the vaccine is only for those over 16, and understanding that access is voluntary, would it be possible for those under 16, if they wish to be able to do so, be vaccinated? The second question is if I could clarify the definition of residents able to obtain vaccinations. Would this generally include LTVP employment work pass holders? Thank you.
So, for the second question, it's in my speech, so I think I've answered that question in order not to waste time for the House. On the first question, I would strongly discourage those below 16 to volunteer for vaccination, primarily because the initial clinical trial does not include or did not include those below 16. So if you do take the vaccine, you will be taking a risk, and I'm sure my healthcare professionals will not be in a position to give you a vaccine that has not been authorized for use. So I would say, please don't get vaccinated if you're below 16. We are monitoring. The trials are ongoing. Manufacturers are continuing to trial on the people below 16, and when the data is available, we are able to verify that they are safe and efficacious for those below 16, and we will roll it out for those below 16.
Mr. Darrow David.
Thank you, Mr. Speaker, and thank you to both ministers for patiently and thoroughly explaining the process to us. I would like to ask one clarification, which is related to what I think Minister Lawrence said earlier about, for whatever reason, health, emotional, psychological, should individuals choose not to get vaccinated, is there any possibility that it could therefore then end up being excluded from certain activities, from certain places? I think Minister mentioned that they might have to take more thorough tests, but I think this was raised to me actually by a couple of my residents, and they said if I choose not to take the vaccination, will I be stopped, say, for example, going to watch a movie? Will I be stopped from going to school? Will I be stopped from doing certain things if I do not get vaccinated? If Minister could perhaps clarify this and give the assurance that they will not, perhaps the government will not go down this path, it would be useful, I think, for those who don't get vaccinated to know. Thank you, Minister.
Mr. Speaker, as we've highlighted before, without a vaccination, there will be all the various measures that are in place, whether it's testing, whether it's safe distancing, whether it's tighter controls around a particular venue. These are all the prevailing measures that we are used to. They will continue, right? When vaccination comes in, we may relax some of these requirements. So it's not about saying if you didn't get vaccinated, many of us are not vaccinated today except for the healthcare workers, but we can do many activities subject to prevailing guidelines, prevailing safe distancing measures. The idea is that when you get vaccinated, perhaps some of these measures can be relaxed, and we are studying what are the potential changes and adjustments that we might allow and consider. So it is not going to be a situation where we say, no, you can't do this, but it's more likely to be a situation where vaccination will allow you some benefits in terms of activities, in terms of being exempted from certain requirements. Exactly what these are, as I said earlier, it's under study, and when we have the data, evidence, when we are clear about what changes are possible in our guidelines and measures, we will put that out to the public.
Mr. Jerogam. Mr. Gan Kim Yong.
Sorry, just to add on to Minister Wong's comments, from a Ministry of Health's point of view, at the moment, that is not the important question to ask. The important question is, the important issue is to please get vaccinated. So don't worry too much about what if you're not vaccinated. Focus on encouraging your constituents to please go ahead and get vaccinated. Reassure them that we have gone through a thorough assessment on the safety and efficacy of the vaccines, and we encourage all of you to get vaccinated when your turn comes.
Mr. Jerogam.
I thank the ministers for their statements. I have clarifications on travel and vaccinations. I'm concerned about the increase in the imported cases. Can the minister clarify which categories of travelers are excluded from the pre-departure PCR test? I believe he only mentioned Singapore citizens, PRs, and children under 6 and below. Did all the 12,000 travelers who entered Singapore without a pre-departure PCR test fall under these categories? And were any of the 100 imported cases who did not have a pre-departure PCR test, were any of them supposed to have had the test but did not do so? On vaccinations, since our vaccine program has already started with healthcare workers, to give the assurance to everybody, including healthcare workers, that the vaccine is safe, shouldn't our senior public servants, including ministers, already have been vaccinated by now? So this is not a cheeky question, but I believe it will give Singaporeans more assurance to take the vaccine. And lastly, is HSA evaluating the AstraZeneca Oxford vaccine, which was already approved by the UK on 30th of December? Thank you.
Mr. Speaker, the categories of people who do not require to take a pre-departure test are spelled out publicly. Singaporeans, PRs, who are returning home, children, those are the key categories. So I would, I have not looked at the data in great detail, but based on the information we've put out, the 12,000 which I cited would largely comprise of these visitors, or these returnees. But as I have highlighted and emphasized, whether someone does a pre-departure test or not, so long as they come into Singapore from a high-risk country, we subject them to a quarantine, SHN. It's quite tight, and we make sure that these cases, if they were to emerge, are isolated and ring-fenced and do not leak into our local community. That's the more important point, and we have continued to do so.
Mr. Chris D'Souza. Mr. Gan Kim Yong.
Sorry, there was a second question with regard to our senior public servants and the politicians, whether we should take the lead. In fact, we will be taking the lead, as the Prime Minister has said so. He will be among the first when his cohort comes. But at the same time, we also do not want to be accused of jumping the gun and jumping the queue, and in order that we are ahead of the others. And therefore, we have to manage the process to ensure that the first priority is given to the healthcare workers because they are exposed and they are at risk. Every day they see the patients, they care for the patients, they themselves are exposed to potential infection. And therefore, the priority must be given to the healthcare workers first, and we are focusing on that. And among the healthcare workers, Professor Liu Yixin, who is CEO of the NCID, was among the first batch to get vaccinated. That's how she demonstrates her leadership and confidence in the vaccine. So I think when our term comes, I'm sure all my colleagues will be very happy to step forward to have to get vaccinated.
Mr. Chris D'Souza.
Mr. Speaker, first let me say that I am pro-vaccine. We have learned quite a lot about new strains or mutations across the globe. Look at UK. My question is, does this vaccine we have subscribed to anticipate resistance to future strains, or are we to get further vaccinations over and above what we have subscribed to? So is this a moving target? Over and above what we are going to get vaccinated for? Thank you.
Thank you. We will continue to monitor the mutation within the virus. I think the scientists around the world are watching and monitoring carefully. As I mentioned in my speech, mutation happens from time to time, and in fact happen quite regularly as a virus. It's basically like a photocopying machine. So it copies itself, and every time it makes a copy, it will be slightly different from the version previously. There will be some specks here and there, some dots here and there is different. That's how photocopying works. And but by and large, up to today, there hasn't been evidence to show significant shift from the severity of the vaccine, of the virus, or the impact on the effectiveness of the current vaccines that are being approved or reviewed in Singapore. So we continue to monitor. It is possible that one day the virus may mutate and we may need to modify our vaccine in order to respond to the new virus. And with the current vaccines that have already been developed, I think it will facilitate the development of new vaccines if it becomes necessary to respond to new strains of a virus, particularly with mRNA. With the platform of mRNA, it's much easier for us to replicate new, to produce new vaccines in response to variations or mutations in the virus.
Mr. Leon Pereira.
Thank you, Mr. Speaker. So I thank the two ministers for their detailed statements. Just three supplementary questions for the Minister for Health. In regards to where the vaccines will be administered, can we take it that they will be administered at polyclinics, public hospitals? Will GP clinics also be involved? And will every effort be made to ensure that the vaccines can be administered in locations that are close to where people are living in diverse locations across the country? First question. Second question is, will every effort be made to bring the vaccination process to elderly Singaporeans who are in nursing homes, senior care centres and so on, who may not exactly be very ambulatory? And thirdly, just to follow up on the question that my colleague Mr. Gerald Giam asked, I don't believe it was answered, is the government evaluating the Oxford AstraZeneca vaccine as well? Thank you.
Thank you. I think there are quite a number of vaccines that we are currently evaluating. I won't be at liberty to go into details of which are the vaccines that we are evaluating. It also depends on the information, the data that we are able to get. HSA has now adopted a progressive rolling review approach, as and when data is made available publicly or bilaterally from the manufacturer, we review them and we get ourselves updated as much as possible, so that when the application is made by the manufacturer for the vaccine to be registered, we will then be ahead of time to be able to make a quick assessment rather than to start from scratch. And therefore, we do this rolling review approach in order for us to speed up the approval process. So I would say that most of the vaccines that are currently being developed, HSA has been keeping a watch on them and assess and review the data as and when they become available. As and when a vaccine has submitted applied for registration, we will then go into a full swing evaluation. And I won't be able to share what are the vaccines that have applied beyond the three I mentioned earlier. The other questions are where will the vaccination sites be? I would say that we will generally take into account accessibility and convenience for those who are receiving the vaccination. For the healthcare workers, most of them will receive the vaccination within their healthcare institutions. They have an existing system to vaccinate their staff, and they will tap on those. For the general public, we will set up vaccination centers across the island. We will also tap on the polyclinics that are available, operating today. But bearing in mind that the polyclinics also have their usual patients that they need to attend to, so we would not be able to squeeze everyone into the polyclinic for vaccination, and that is why we also will need vaccination centers. We will also be working with private GPs, general practitioner clinics, to help us to administer the vaccine, especially for those who are less mobile and will need to get to a clinic that is nearby. So we work with the private clinics as well. Having said that, we have to bear in mind that this particular vaccine, Pfizer-BioNTech, is quite challenging to handle, as you are aware, that it requires ultra cold chain, minus 80 degrees, and needs a very careful handling in the administration of the vaccine to the individual. So it is not so easy to make it available conveniently at all the private clinics. So we will need to work with specific clinics and specific chains, as well as work with specific selected vaccination sites, so that we are able to construct the infrastructure that is needed for this extra cold chain storage and administration. And for the nursing home and the senior care center, yes, we will make special arrangements to make sure that we are able to vaccinate them, because many of them are not mobile. So we are planning to set up mobile vaccination teams that will be deployed to some of these nursing homes and senior care centers to provide the vaccination services for them.